I've had several experiences with surgeries and other hospitals, and I thought the pre-op program here was better, more informative, along with the fact that you saw pieces of the apparatus and you knew everything that was going to happen from the time you arrived in the hospital until your departure. The best part I found of the whole program was upon admission, you are brought directly up to your room for your prep for surgery. So you know where you're going to be afterwards. You already know your staff. They stay with you the entire time. They take you down and you wake up and there you are back in your room, same bed you left in the same staff. And I just found that as a nurse, I had never ever seen that procedure. You usually go to a pre-op area, and it was very comforting. You didn't get nervous wondering what was going to happen next. And the nurses that you were working with were able to tell you it wasn't like you were just working with the pre-op nurses. They were your pre-op, your post-op, and your discharge. Group therapy was excellent here. The woman that runs it was fun to work with. She was always providing a laugh. She was aware of people that were progressing further, and since I had this done 3 months before, I knew a lot of the exercises, and with supervision she was letting me proceed further than maybe some of the other folks were. And there were people in there that were having both knee and hip joint replacements, so there was a little bit of difference in the exercise, and she handled all of us beautifully. And the last day we played games and won prizes. It was fun, yes, it really was. There were teams, and we weren't real competitive, but yeah, it made it fun, and it was the last time we were all going to be together until we see each other again in December for those that are going to come to the party. So yeah, it was enjoyable. I watched all the relaxation videos on the television. I enjoyed them all. The scenery on some of them was just magnificent, and you get kind of caught up in what you're watching and forgetting where you are. I complained to somebody about I said, I understand we were supposed to have hand massages, and they had been really busy, and about 11 o'clock at night, one of the aides came in and said, I'd be happy to do it for you. And I said, oh no, it was late and I know her shift was ending. Having been a nurse, I thought, I shouldn't even be complaining. But the very next day, somebody came and I got a hand massage. And that was heavenly. It really was. And at the luncheon, I guess a couple of other people had not. One of the gentlemen was sicker than some, and he hadn't had it, and they offered to let him do it after the luncheon. So yes, but I think the television videos are wonderful. I have not done nothing but praises. The interesting thing I found is that a lot of people, I'm local here now for 2 years, although I've been here for 20 something. A lot of people, they say, Nanticoke Hospital, where is it? And I said, oh, it's over in Seaford. And I said, as a nurse, I can't say anything that isn't wonderful about the hospital. And people are like, really? And then they asked me who my doctor is, and I said, there's several doctors that participate in the program over here. And then I tell them about this new anterior approach with the hips and how quickly you're in and out of the hospital. So I've done nothing but tout how wonderful the hospital is since I've been a patient here. And I truly think if it was not a dire emergency and I needed to be seen in the emergency room, I would drive from Bethany to come over here to the emergency room rather than where I can go. When I arrived at the hospital, I registered in with the receptionist downstairs, and prior to leaving on your second or third day, however quickly you've been able to leave, they have a luncheon for us. And you're with the patients that you've seen in group therapy or seen walking around in the hall, but you've come in contact at that luncheon with every person except the one person that was down at the registration desk that has had contact with you the entire time you're at the hospital. When I came back once for blood work, I just came up to visit because I felt comfortable just coming up to say hi to the staff. So you truly do, and I passed that on to people. They said they had a luncheon, and I said, yes, and it was a really good luncheon. And then I mentioned also the upcoming Christmas party that we're going to attend in December to see the people, and there'll be certainly people that I don't know because they've had their surgeries long before I did, but they've been with the last, I think they come within the last 6 months of the last year. So yes, the staff, everybody from A to Z sees you as polite, says hello, and asks how you're doing and smiles at you. Friendly staff, very interested in you as an individual. The atmosphere is quiet, comfortable, was never noisy. Just in general, I don't think that you could go anyplace else for better care.